All right, everybody. Welcome to the 2026 January Cares webinar. It's titled Be Your Own Advocate for Your Health and Your Healing. My name is Dwayne Ellis. I'm the Outreach and Training Coordinator for the Georgia Council for Recovery, but above all, I'm a person in long-term recovery. And what that means for me is that it's been 9 years since I felt the need to use any mind-altering drugs to change the way that I feel. Today, I not only speak out loud to show others in addiction or in recovery that their voice matters, but also because silence never did me any good and never healed me. Stigma and shame are no longer reasons for me to stay quiet. So, this 1.5 hour webinar is designed to provide an overview of the book Advocate for Your Health, showing how individuals can prepare for medical visits, organize health information, and use their voice to improve both personal and generational health outcomes. But furthermore, y'all, this kind of ties into the work we're already doing. This session also equips certified peer specialists and those working in the peer workforce and others in advocacy roles with practical strategies to support peers in medical settings and help them build confidence to advocate for themselves and the peers that they serve. As people in recovery heal, taking care of their physical health becomes part of that journey. We as individuals have the right to be the experts of our own life. So I'm going to go over some housekeeping really quick. This will be interactive. So we ask for your engagement and participation. Please keep your microphone mute if you are not speaking, or me or the co-host, Derek Little, will mute people as needed. Everyone who remains until the end of the webinar will receive 1.5 CEUs. You will receive a certificate from our database coordinator, Alvin Cotton. Y'all all know Al probably. And it'll probably go out next week or so. Anyone who shows up more than 15 minutes late, however, or they must step away for that long, they may continue to attend the webinar, but they will not receive credit. And that's for individuals who show up more than 15 minutes late. Again, the certificates will likely go out early next week. You can search for the name Alvin in your inbox if you can't find the certificate. Make sure the name on your screen matches the name you want on your certificate and that you include your pronouns so that we can address you correctly. Before we get started today, we're going to do a quick poll as we always do. We want to know who's in the room. Give me 1 second to launch the polls. Here we go. And there we go. Who's here? You could select multiple. We got a lot of CPSAD, a lot of cares, a couple clinicians coming in, recovery allies, a lot of CPS mental health, forensic peer mentors, got a couple of those. Thank y'all for joining. Others, we got allies, care 67 in the house. Okay. I'm gonna give it about 10 more seconds and then I'm going to end the poll. Care 78, Care 76. All right, I'll share the results. Look at that. We got a lot of cares, aspiring cares, couple of clinicians, recovery allies, MA, CPS parent, forensic peer mentor. Pretty diverse. Cool. Without further ado, I'm going to turn it over to Henraya McGruder, and I'm allow her to introduce herself. And thank you for doing this.
Dwayne, thank you so much for having me. Georgia Council for Recovery, thank you for inviting me for this presentation. I'm thrilled to talk about something that I'm so passionate about. I do want to acknowledge my family that's on the call to support me today, so thank you so much. Um, I My name is Henraya McGruder, and I'm just a scientist. I'm a woman who um, has a couple psychology degrees. I have degrees in psychology, but worked for the federal government for a long, long time, for 22 years. And as I worked at CDC, I used to have to write a lot of manuscripts about health conditions and the state of health conditions in the United States. And so that was my career. And I enjoyed doing that work um, until it abruptly came to an end. But I had a dream when I started, or an idea that came about when I was writing these manuscripts. I was like, we're writing about reporting on these health conditions of people. And, a couple of racial ethnic groups keep rising to the top. It's always African Americans and Hispanic Americans who are always at risk for all of these chronic diseases. But when we get to the end of the reports that we're writing, we don't really have any solutions for them. There are population specific solutions, but nothing that's really going to help them alter their health in a meaningful way on a patient level. So I would just think about, well, what would I do? What would I want to help people do? And I would want to explain what things mean. Maybe people don't know what conditions mean. Maybe they don't know the right questions to ask. And I would want to be that bridge. And I just didn't know how it was going to come out. And fast forward 22 years, a book popped out with the information. So I'm so grateful for the journey that I'm still able to educate people in this way that will help along the public health journey to help inspire people individually to manage their health differently. And maybe through this presentation, you'll learn something that, or have a revelation about, oh, I didn't think I could do this in the doctor's office, or maybe I could handle myself in a different way. And you will feel empowered in a different way to manage your health differently. So that's me. That's who I am. I'm a mom. I have two adult, I hate to even say that, adult age kids who are in college, and they inspire me every day. I'm a wife of 22 years, and I'm just a forever learner. I realized very early on in my life that I'm one of the helpers, and this book helps me stay authentic to myself that I'm still one of the helpers. So I'll just jump right in if you all are ready. Okay. Today, today the presentation is entitled Be Your Own Advocate for Your Health and Healing. And I'm going to start off telling you where we're going. I'm going to give you a roadmap. I'm going to really already talked about, I'm going to define what a health disparity is. I want to kind of define how to advocate for yourself. There will be an interactive activity that's going to be about 10 minutes. And in the activity, you're going to role play what it looks like to advocate for yourself or not advocate for yourself. You're going to take on roles in groups of four of you're going to either be a patient advocate, or someone advocating for the patient, a healthcare provider, and then there will be an observer. And the observer is the person who will report out to the group what happened in that group. And participation is voluntary. And if you'd like to participate in this activity, please enter advocate in the chat so that Dwayne can then create the breakout rooms. And I'll say this again throughout the presentation as we get closer to the activity. Please put advocate in the chat if you'd like to participate in this activity. Once the activity is over, we will evaluate how it actually went. And then there'll be time for questions and answers. There'll be time for questions at the end. So moving on. This is me. I told you all about this a little earlier. I worked at CDC for 22 years as an epidemiologist. Loved, loved, loved my work there. Felt very fulfilled in feeling like I was helping, really impacting the health of Americans as in my work there. I have a master's and PhD in neuropsychology from Howard University. I created Audacious Health Advocates with the mission of what this book is even about, educating people in ways for them to be empowered and advocate for their own health. I started this LLC in 2022, And that was before this book even was a twinkle in my eye. So this was just an infrastructure that I had this idea a long time ago. Currently, I teach a psychology course at Spelman College. I'm a first-time author. This book was my first book. Maybe there'll be more, not sure. And I have a true passion for health disparities, which we will go into next to define what is a health disparity. A health disparity, just a second, let me move this over a little bit. A health disparity is a particular type of health difference that is closely linked with social, economic, and or environmental disadvantage. And this is defined in the Healthy People 2020 a reference. And examples below are what health disparities actually look like in the data. When you hear this in the media, this is what a health disparity actually is. You might see statements like this. There are significant racial and ethnic differences in pregnancy care, with non Hispanic Black women incurring 3 to 4 times higher rates of pregnancy related death compared to non Hispanic white women. That is a health disparity where two groups are not equal when it comes to a disease or condition. Another health disparity is, according to the CDC, non-Hispanic Black adults and Pacific Islander adults have the highest rates of death among stroke compared to other groups. Now, these are statements that you'll either see on the news or in manuscripts that are published in journals, but not many people read journals, medical journals. Not many people read this scientific writing in this way. But when you see that one group has a higher level of disease than another group, that is what a health disparity is. And that is where we want to try to close the gap between those two groups. Hmm. Okay, why is it? Okay. So the birth of the Advocate for Your Health came about trying to come up with patient level solutions to help reduce health disparities. And the book was published in October. It's less than 70 pages. I heard on good authority that it's an easy read, but we're going to walk through what's in the book now. So we want to talk about, why do we even really want to advocate for our health? What does health advocacy even look like? It's to support the patient in the healthcare space, enabling them to increase their understanding and participation in their own healing and care. So I just want to stop there for a moment and ask you, just paint a picture for you. When you go to the doctor, just you, or if you've gone with your child or a family member for that matter, were there times where you felt like you didn't understand what the doctor or the healthcare provider or the nurse or whoever was interacting with you? I will just have an umbrella term of a healthcare professional. Did you feel rushed? Did you feel like you just didn't understand, or that the doctor or the healthcare provider was so busy, you may have had, did you walk out of the appointment saying, oh, I didn't tell him this. I wish I could have said this or that. Um, there are going to be some tactics here to help you not feel that way. But a lot of people feel that way. I even feel that way sometimes when I go to the doctor. And I would say a lot of people do. And another aspect of health advocacy is to ease the burden and destigmatize fear of the healthcare space that some people feel. I've in conversation around this book, I have heard people say that they see the healthcare provider as the authority. How many people in this Zoom room feel that way and feel like they are of lesser importance than the person providing the care? Part of this presentation is to help you reshape that. Okay? So, what does it look like when you don't advocate for yourself in the healthcare space? An example of a patient not advocating for themselves is when a patient interacts with the doctors and doesn't ask questions. They just take the paperwork and walk out. They don't provide contextual information that is useful in their care. Like, what are the symptoms you're experiencing? Are there any uniquenesses around the symptoms and when they happen? Is it when
Remarkable and
you
great
eat
voice for
something?
magnificent people of Venezuela. Machado was
Is it when, it does it happen at certain points in time? Do you let the doctors make a care plan without your input? And are you leaving a gap in the care continuum for the patient where you just don't even really show up? And if this looks like you, there's no shame here. There's no fear. A lot of us feel this way. A lot of us have had this experience. Hopefully that will change in the next few slides. So I think this is the punchline for the entire presentation. I know I have a few more slides. I could stop here with this most important point, but I'm going to really put an exclamation point here is that without you, you have to see yourself as the expert on you. The healthcare provider is not the expert. You are the expert on you. And without you showing up and providing the contextual information, providing the symptomology, showing up authentically, unafraid, there is no point of the visit really because you're not showing up authentically to get the care that you deserve. They're not seeing the real you and the real symptomology. They can't treat you the way effectively without you showing up and being the expert on you. So if there's anything that you take away from this, this is the most important point of this entire presentation is that you see yourself as the expert on you in this entire situation within a medical visit. So I'm just going to go through a few things in how you prepare for medical visits. And these are ways, I think these 3 steps are ways to help you feel more empowered and like knowledgeable when you go into your medical visit. There are 3 things. The first thing is a symptom diary. The second thing is a medication log. And the third thing is a collection of your family health history. And I'm going to talk through them a little bit, one by one. By show of hands, you can put a hand up in the chat. Has anyone ever prepared a symptom diary before? Do you even know what one is? Good. I see a hand or two. Thank you. Thank you. That's great. Um, this little screenshot, I'm not really sure if you can see it that well, but you can Google a symptom diary and come up with some examples. In the back of the book, I have some URLs that are there where these actually came from. But it's really being aware, it's raising your level of awareness. A lot of us kind of go through life rather passively, and then you just show up and you have like a pain somewhere, or you have reflux, but you don't really connect how did it get from point A to point B. So sometimes we have to slow down and think about when you're having the symptoms. When does it happen? How severe are the symptoms? Is it a time of day? Is it associated with some type of food that you are eating? Is it associated with an exercise you're doing or some of that? All of that information, however small or extensive that you can gather, is so important for the physician or the healthcare provider to have. Now, I'm not asking you to walk in and just throw a bunch of papers in front of your physician. I'm sure they won't appreciate that. But I mean, it's information to help guide a conversation with your healthcare provider. The second one is a medication log. A lot of us now, if you get all your medications from a particular retailer, you can pull all that information up on your phone. You don't have to have a sheet of paper that is written down on. A lot of us have smartphones. You can line your medications up, take pictures of each medication that you have so that you then can share that with the healthcare provider so that if you are prescribed medications for anything, any new condition that you may have, they can have the medication log to see if there's going to be any kind of interaction with any of the medications you're already saying and you're already taking. Some medications may not work well with others. So it's good for the healthcare provider to actually know what you're taking, sometimes even down to the over the counter things like your vitamins and supplements that we kind of forget about some of the things that we also take. Um, along with prescribed medication. So that's what a medication log looks like. I have a link to one where you can write, but there are other very creative ways, like ways that I mentioned, of taking a medication log either with your phone or screenshots from your pharmacy of all of the, or just talking through them with the healthcare professional when it comes to them prescribing something new for a condition that you're going in with. The last thing that I want to talk about is gathering your family health history. Now, sometimes this could be a little tricky, but you might not be able to get everything that you need. But I read as I was preparing for this book, writing this book actually, that Thanksgiving is National Family Health History Day, when families gather, and it's a good time to try to, gather your family health history. Now, sometimes people may not know what people have passed away from, what kinds of conditions people have, things come through bloodlines. Sometimes it may be taboo to talk about what someone passed away from, but as much information as you can gather, it would be great. Now, there are some emotions that may go along with this. People may be sad when they talk about how someone passed away or what they passed away from, and you may get incomplete information. But if you have a group of family members that can pull some information together, trust me, that helps everyone. That helps everyone. And it's not just physical things. You might also want to take note of people who have neurodivergent types of conditions like ADHD and dyslexia and autism and things like that. That's also those are things that are newer things that you might not think to have in your family health history, but it goes a long way when you start thinking about, let's just gather this information. Let's get a picture of what the family health history, knowing that sometimes some of your family health history you can't really change because it's in the bloodline. But if you know that hypertension or high cholesterol is in your family history, you might be able to exercise more or have a more heart healthy diet so that you don't get to the point of needing medication for high blood pressure or high cholesterol. So this family health history is extremely important in ways that you live your life and your family members live theirs. So these three things will help you prepare for the medical visit. I'll stop there for just a second just to sip some water. But I just want you to think about how important it is to prepare. And I just want to see while I'm sipping my water, have you ever put in the hands that come up in the chat? I don't see any hands. Who who thinks that they might want to do this? Asking people, I was asking people who has anyone ever prepared for a medical visit in this way before?
Jonathan Reed, would you like to share?
Sure. I mean, I've had a lot of health issues for about 38 plus years. So yeah, at times, if it gets, especially medication lists, like you were saying, photographing is so much easier if you got to know the doses and the milligrams and all that stuff. But yeah, it's helpful to have all that stuff together if you really want to have a meaningful conversation with your doctor. If you're concerned about something. I've done it plenty of times where I've prepared before I go in because I know their time's limited. So
Well said, Jonathan. Thank you so much. Audrey?
Yes, thank you. Yes, I have. My husband had Parkinson's disease, and he was completely bedridden for the last 6 years of his life. So I kept a log of all his medications. I kept a log of all the things I had to take his, his blood pressure and all of those things, the heart pump, and it was very helpful when the nurses came in because he was on hospice and they were able to see how he was doing as well as the things that I would tell them in addition to that. So I enjoyed that.
And you sound like you are a very good health advocate for him. Thank you for that. Misty?
Hey y'all. So for me, when I first got clean, I went ahead and did a physical and all the things, and I wasn't having any issues. But so the past year or so, I've been having anxiety and stuff, and so I've had to be really careful about keeping track of what triggers it. Is it a food? Is it something, so that when I do talk to my doctor, I can ask the questions I need to, and I was going to see my doctor before I switched, and he was very like, he would rush me out. And I just felt inadequate to be able to say, look, I have questions. And so finally, on my last visit, I was like, look, this is a problem. And I was able to be assertive, but kind, and like ask what I needed to ask and listen. If I didn't understand, I would tell him, look, I don't understand what you're saying. I need you to break it down for me. I ended up switching doctors because I did not realize how very important it is to be able to have communication with your doctor, because if I'm confused, I'm not going to be able to take care of my body the way you're telling me I need to, because I don't understand what you're saying. So anyway, it was just being able to stand up for myself and say, look, this is what's happening. Here's the medicines I take. What is going on? You know what I mean? That's all I wanted to say.
Thank you, Misty. You brought up a couple things that I was going to mention actually. It's I'll get to it later, but so those the visits, you only have like a 15-minute, a lot of time you only have 15 minutes with your healthcare professional. It's really great to go ahead and upload some of this information through the portal, so that way this part is taken care of. You're giving the healthcare professional some homework. Also, if you want a longer doctor's visit, you can ask for one. This I just on a personal level, I was having a health issue and I did not understand why my doctor was prescribing a procedure to me. And I was sitting in the doctor and I was like, I do not understand why you are prescribing this procedure to me. Can we talk about it? I need to talk about it before this even starts because I just don't understand. And do you know the doctor actually, the shoulders went down, she turned toward me, and we had a 20-minute conversation outside of her performing a procedure. I thanked her. She thanked me. I've never had this experience before. She was like, this really rarely happens. And this was before I was even writing this book. I was like, I don't understand what's happening here, and I need to know what is happening. So you can ask for that. You can ask for a longer visit. You can let them know what your concerns are. Don't be afraid to ask. You've been told no before. This is not hard. Okay, Susie?
Hey, can you hear me?
Yes.
Okay. I was just gonna say that one of the things that I've found very helpful was letting my doctor know of like family history of things, because my father actually had colon cancer, and because of that, they're now screening me early for early prevention. And so I find it very important to do that. Also, like asking questions is very important for me. I ask a lot, my doctors all kinds of questions. Like, I want to know everything about everything. Like, what's this do? Why do you want me to take this? Is there anything else that I can take instead of that? What are the side effects? And how is this going to make me feel? Am I going to feel nauseous from it at first? Will that go away? And I've had to keep like logs of like how many times I've been depressed, to give to a counselor, a therapist, so that they can understand how often I'm experiencing anxiety or depression. All these things are very important for like doctors to understand your needs. So I just, this is very important. I think this, making diaries, and I've never called it a diary. I've called it a log, but
Mhm.
I'm thinking it's, pretty similar to that. And it's just really, really good to just be really open with your doctor. If you don't feel like you can be open with your doctor, get a different one. That's my opinion.
Very good. Very good. Amanda?
So I've been doing advocating for my uncle for almost 4 years now. He actually has a trachea and he has no voice box. So we have to daily write his blood pressure down. I have to daily write his blood pressure down, morning and afternoon, all the medicine, all the vitamins, when he does an inhaler, when he does his breathing machine. So I'm very, very familiar with a symptom diary,
Mhm.
and the medical log. Every day that one is added, it's when it's every day it's gave to him, every amount of dose. So yeah, I'm very familiar with the medical visit of asking questions and questions on top of that questions. I call it doctor overthinking is what I call it.
Uh-huh. I love it. Thank you, Amanda. Chantel?
Thank you so much. I had done when I started to see my mom's health decline and she was starting to see more and more doctors, like specialists. And she had a variety of medications by different doctors. And she wasn't, after a while, she wasn't sure why she was taking certain ones.
Mhm.
And if she went to a new doctor, I would be like, from a distance, it'd be like, did you tell them you're on X, Y, and Z? And she'd be like, oh, I forgot about that. So I started a spreadsheet essentially,
Mhm.
which also had a column as to why she was taking that particular prescription, as well as like the name, the dose, and all of that, and which doctors were prescribing it. And then when I started taking care of her more, it was really helpful for me going to the doctor's offices and just having that available, especially when through portals and just turnover, I guess, nowadays in doctor's offices and how records are kept. Some offices would have her on medications that she hadn't been on in a couple of years. So it was like that constant, making sure they had an accurate list. And also, it was important that the variety of specialists knew what another doctor was prescribing, because there were times where certain medications were contradicting another medication. And so that was
Exactly.
really important. Thank you very much.
Thank you. And that's excellent on the medication interactions. These will be our last two, and then we're going to jump back in the presentation. Arnold?
Can you hear me?
Yes. Mm-hmm.
Okay. How you doing? Say hi to everyone. uh, I wanted to say that I found it in an early part of my life, but dealing with doctors. Like early part meaning 10 years old. Eye surgery, ear surgery, a lot of different medical problems coming up, asthma. So I was one of them kids. And a doctor told me a real long time ago, the best doctor is the one that listens to you
Mm.
and asks you. So when I see that you said, I am more important in this process. So I've kind of always knew that. And to the point where when I got a little older, I almost would catch an attitude if a doctor is not listening to me. And I would ask them sometimes. I've had doctors where I have to say, do you know what happened to me last night? And of course he don't. So let me tell you, because I've had doctors say, well, let me do my job. Let me just take, okay, you can take my pulse, you can take, whatever vital signs or whatever. But when it comes to my situation and why I'm here, I would like to explain that in detail and let you know exactly what I'm feeling. I'm not a doctor, so I don't know what's happening this is why I want to ask you. But that is very, very important. And then I like what you said about my history. So I had to know what my father been through, what my mother, her mother. I had to know these things because of some of my complications. So I go to the doctor one day and they say, well, okay, let me check this out and check this out. Next thing I know, the ambulance coming through the door because the doctor got paranoid. She got excited because my heart rate was very, very slow. So a few people in my family had pacemakers. So they were saying, well, okay, you'll probably have a pacemaker by 65, just making an estimate. But just wanted to say that it is very important to do your own talking at a doctor's visit because some of them won't allow you, and that's a shame. So I really
Thank
like
you.
that.
Thank
Yeah.
you so much. It brought up one. I'll try to hold this comment. Dawn, you go before you'll be our last one.
Oh, okay. Hello, everybody. I'm Dawn. I what came to me was when I first grew up and started taking care of myself. Um, I had a doctor that I saw on a regular basis, and she taught me how to um, put write down stuff like my medications, my blood pressure, when I was in her office, and and then my yearly procedures like mammograms and uh, next doctor's appointments and my medications. And every time I'd go to see her, she was like, "Do you got the Book of Dawn with you?" So that helped me out take care of myself, and how it made the doctor's appointment go well. And then I got to know myself better and take care and teach others how to do it too, to keep a book of themselves wrote down. And I, like today, I went to get on the scale, and the nurse, I was like, um, I think I need to lose some weight. And she was like, "No, you are 2 pounds less than you were last time." And I looked at my books, and I was. So yeah, I like the Book of Dawn.
Yeah, I like that phrasing. I have a book for each one of my children from birth till age 18, from when they aged out of the pediatrician. And I know that's extra, but I can go back and look when they got their tonsils out, when they got their ear tubes. And I just kept their records that way.
Yeah.
What so thank you, Dawn, for
Yes.
that comment. Maybe we'll have some extra books of whoever on the call now because you shared that. I appreciate that. The one last thing that when Arnold brought that sparked a thought when Arnold was sharing is
Hmm.
that imagine if you don't know the blood types of your parents and something happens to you and that you need to have some blood transfusions and you don't know what blood type you have or your parents had. That is crucial. That means that the healthcare professionals have to make a decision. And they have to make a decision because they don't have enough information. But if you gathered that information and it was in your family health history, then they would know right away, give her this, give him this. So that's another real important part that came up. I gave this presentation at Georgia Tech last month, and that was something that came out of that conversation. And I was like, that's really interesting. No, people wouldn't think about something that's that simple, but it's so important if you are in critical care and you need a blood donation or a blood transfusion. So I'll leave you with that. So thank you for everyone who shared. Now we're going to move into what it looks like to advocate for yourself. Um, Here we go. One big thing that I want to share when we're talking about here's the action. You're in the room with the healthcare professional. You might be there with the nurse, or I'm blanking on who all it could be, but the doctor, the PA, the nurse practitioner, whoever it is, you're in the room with them now. Advocating for yourself doesn't mean having an attitude and coming in like you didn't do this and da, 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 da. No, it doesn't mean that. It means we're confident, we're clear, we have a plan, we are prepared, and we're going to come at this. And if we don't understand something, we're going to ask for clarity. That's what I mean by check your attitude. Just we're going in here calm. We have a plan. Let's see if we can work this plan. If it means bringing your documents with you, bring them with you. That also means upload them to the portal. Pay attention when you go in here. Silence your phone. Nothing. Just take your earbuds out. I know this is really simple, but you have to pay attention. You have to be in the room. Your copay got you here. Now you want to get the most out of this copay, pay attention to what they're saying to you. Okay, copays can be a lot, so I want you to be curious when you go in there. You don't know what something means, ask. You have a question, don't be afraid to ask questions. And so now we're going to go into some examples. The next thing, I think we're leading right into the activity, which is we have, if there are any people in the Zoom room
One
now,
second, Henraya.
okay,
So if you have already put advocate in the chat, do not put it in again. I promise I have double, triple checked and I got you listed. We're at 35, but you can continue, Henraya.
okay. So here's what we're going to do for the people who have put advocate in the chat that want to participate. We're going to have teams of 4. And what we're going to do is we're going to role play a medical visit. And there are going to be 4 people on the team. There's going to be a patient. There's going to be a patient advocate for the family member. And you can either choose to have the advocate advocate for them or the patient advocate for them. It's either way, you have latitude of how you want to do this. Um, you want a healthcare provider who is going to interact with the patient and or the patient advocate, and then there's going to be an observer, and the person that is the observer is almost like a tennis match. You're like watching what the patient is saying, watching what the healthcare provider is saying, and gathering gonna summarize what happened to the group. Okay, so in the group, you're going to come up with a health issue to discuss with the provider. You have asthma, whatever it is you want to come up with is fine. Um, and then you have a choice. You can either role play advocating for yourself, or you can role play not advocating for yourself. Now, there are some example questions that I have provided that are straight from the book that may have been in an email that was sent out. And it's just a list of questions that you can use. Anyone there for your use for being on this call, and you can use them. But if you're in the group, you can use them to guide your conversation. And the observer will take notes and provide feedback after the role play session to the entire Zoom room. Are there any questions? This should be fun.
So because of the number, it didn't break out into 4. There are a couple groups with 5. Who could that 5th person be? Could it be another observer or,
Sure. It
okay,
could be another observer. It could be another patient advocate. So the patient could be a child, and
perfect.
then the patient advocate could be a mom and a dad.
Perfect. That'll work. Okay, y'all. So if there's no more questions, I'm gonna open up the rooms. It's set for 11 minutes. It's really a 10-minute exercise. I'm giving you the extra minute to decide who's gonna be who. And y'all enjoy. Okay, so we're back from the breakout rooms. We want to hear from the observers. We'll give everybody, each group, a minute each to just report out what they experienced. So starting with the first group, the group with Amy Walker in it. Who was the observer in that group? Amy Walker, Melissa, Reginald McGruder, Susie White, and Terilyn Usher. Who was the observer?
Susie.
That would be me.
Susie, could you please report out?
Yeah, sure. I think we had a wonderful session. It was full of a lot of details. The patient was having symptoms of early Alzheimer's. They were having memory loss, repeating things, losing things, getting lost while driving. And the advocate, asked a lot of questions like what alternatives are available other than meds. Um, you know, info about frequent isolation, what they can do about that. Transportation may be available through insurance. Getting around people and having interaction with them would keep them, not as isolated. Also asked about a specific diet, if that would help, and if there were any exercises that could help them, promote good health in that situation. The doctor um, offered a lot of good things. It started off with medication being offered. The advocate brought in was like what alternatives, and so the patient was also very interested in other alternatives. Other alternatives that were offered from the doctor was a daily routine, apps that may be available for reminders, and how asked how the support system was. Their support system, the patient said was good, but that they could have some more interaction in their life because their husband works all the time and needs more interaction. The advocate and doctor mentioned senior centers that may have like groups and classes that can be offered, and it also would promote and a routine that they could get into, which would then promote memory retention, or is that the right word, retention, where it's more? And then, the doctor also for a diet said that they could eat minimal processed foods, eat more whole foods, and that a social worker could help them get set up with a plan or a meal food distribution.
Thank you. That's excellent.
Golly, y'all, y'all did it. Great job. Next
Yes.
group, next group. Chantel Morton, Cornell, Carradine, Kathleen Farley, Todd Davidson, Trish Florin. Who was the observer in that group?
I was the observer in that group.
Okay. Kathleen, report out, please.
All right. So what we had Todd as our patient, Chantel was our doctor or provider. We had Trish for the advocate. Um, Todd went in complaining of shoulder pain, essentially neck and shoulder pain. And Trish made sure to touch on that to support him when he said he didn't want to be focused on pain medication. His main focus was like, when is this going to go away? What is this? What do I need to do? And the advocate was like pushing for examining all of the options, expressing the desire for steering away from the medication, and adding, additional information like numbness in the hand and issues with maybe a pinched nerve about 6 months ago. And then we had the doctor basically talking about x-rays and touching base after doing some x-rays. But the advocate mentioned, insurance concerns with cost and efficiency, like can we do some of these visits for touching base? Can we do phone calls instead of having to come into the office and worry about an additional copay? And, if the doctor wanted to recommend physical therapy later on, were there resources to help with paying for physical therapy? The doctor tentatively referred them to what I would call a resource officer. And, the advocate continued to ask about the patient's comfort level and consent with everything that had been decided so far, and to make sure that everything had been covered, um, and wanted to ask about what could be done in the interim while we're trying to figure this out to increase the patient's comfort level. And then after making sure that the doctor knew that they didn't want to be on any pain medication, the doctor, touched base on whether they wanted to do over the counter things that were maybe more to their liking, like simple Tylenol and ibuprofen just to make sure things were safe for them.
Thank you, Kathleen.
Sounds like y'all had a really good patient advocate in that room. Thanks.
Yeah,
Absolutely.
everybody did really well.
Mm-hmm.
Y'all did great. I'm going to add a timer so we stay on point because y'all experienced a lot in that group and y'all are reporting great, but in the interest of time, I just want to keep it short. The next group is going to be Charlotte Shaw, Ty Cardesi, Aaron Miller, or Landria Harden. Who was the observer in that group?
Me.
It was Charlotte. Okay, Charlotte, if you look at my screen, you'll see a timer start and you go ahead and report.
Okay. The patient was Miss Orlandria. She had went in for her blood pressure medication. She thinks that she was having some symptoms due to being ill, uh, nausea, and the doctor was very supportive after the questions of her medication level dosage. The advocate was Edward. He advocated very well for her to get her scheduled appointment scheduled on time. I mean, not on time. I'm sorry. To her schedules to be appointments for while she was there. And also to schedule some blood work for her because she was being lightheaded. Uh, Shoot, 14 more seconds. But yes, the doctor was very well. You know how I get nervous. But yes, everyone did very well in our group.
Perfect.
Awesome. Awesome.
Sorry, I get very nervous.
Good job. Thank you, Charlotte. Please don't get nervous, y'all. If you're in the middle of a sentence, just finish out the sentence, even if the time expired. Next group, Amanda Ryder, Julia Curiel, Kayla Clary, Marlisa Bailey. Who was the observer in that group?
I was the observer.
Of course, Julia. Okay, you ready?
Yes, I'm ready.
All right.
Okay. So we had a really good conversation. Marlisa was the patient, Kayla was the psychiatrist, and Amanda was the advocate. Um, Basically, Kayla started out by telling she was a psychiatrist, and she told Marlisa her diagnosis, which was schizophrenia. Marlisa responded by asking what the diagnosis meant. At that point, Kayla proceeded to tell her that she was going to start her on medication and explain what the diagnosis meant and what the symptoms indicated, which was the diagnosis. Marlisa said she felt confused. Then Amanda steps in as the advocate, and she asked for proof, such as tests to confirm the diagnosis.
Mm-hmm.
And the psychiatrist, which I thought was a great question, and the psychiatrist explained that there wasn't any blood work that could confirm the diagnosis, but that it was based on symptomology. And she's starting her on medication. And then there was a really great conversation between the advocate and the psychiatrist about medication, long-term exposure.
Keep going, keep going, keep going. Finish.
Psychiatrist basically started talking about various options for types of medication, and the advocate actually asked, is there a way that we can treat without medication? And a really good question that had everybody wondering for a little while. And then the psychiatrist did mention coping skills and some other options, but nothing that nothing for sure, because that really was I don't know what a psychiatrist would even say either. So it was a really good conversation. We could have actually used more time. So
Wow, this is
That's
amazing.
excellent. I love it. I love it. I love it. I love it. I could listen to this all day. Keep going.
Thank you, Julia. Next group, Charlie Baker, Kayla, Melissa Wood, Waketa. My apologies. Who was the observer in that group? Nobody that wants to share?
I guess I was the observer. Our patient, Kayla, was having some problems with her medication uh, a cancer treatment, and it was an exorbitant amount of money since the year started, and her copays, or she hadn't had her deductible met yet. So she did a really good job of advocating for herself with the doctor. The doctor did offer some alternatives as far as different kinds of medications, possibly in the interim. But the one medication that cost the most money, of course, is the one that was the most effective. Um,
Mm.
and so she advocated with the doctor and also with the pharmacy to try to, with the pharmacist, to get them together to cooperate and come up with a resolution. So they were going to, the end result was to follow up again tomorrow to see if they had received the patient assistance, qualified for the patient assistance program to make that medication work. So, but our patient did a great job advocating for themselves and was a great example of that.
Excellent.
Perfect.
Excellent.
And then the next group, thank you, Charlie. The next group is going to be Deanna Walden, Grady Torrey, Jonathan Reed, and Tammy Bryan. Who was the observer in that group?
That would be me, Dwayne.
Okay.
Mr. Jonathan, he was the patient. He did a really great job of being an advocate for himself. He took control from the very beginning. Miss Anna was the doctor, and Tammy was the advocate. I think I have her name right. But Dr. Anna, she asked a broad range of potential treatments, therapy, X-ray, surgery. But the insurance issue continued to be an issue for Mr. Jonathan. He continued to state that his insurance had lapsed, and he was in between insurance right now, and that's the main issue. But he has a plate in his arm, and it's where he broke his arm when he was young, and he has a plate there, and it's beginning to come loose, and it's causing him some intense pain. And so Miss Tammy, the advocate, covered possible insurance avenues, marketplace, Medicaid, etc. But again, the insurance continued to be a issue. Uh, so I don't see any short-term resolution to Mr. Jonathan's issue until the insurance issue gets resolved. But Miss Anna, she did an excellent job of being the doctor. Miss Tammy seemed like she's done this a time or two. She asked all the right questions. I know we're on a very short time right here, but I think everybody did an excellent job. I think I observed the best I could in trying to cover all the things we discussed. But I think
That's
we did a great
excellent.
job.
Thank you.
This is amazing.
Yeah.
I'm really blown away by this. The next group is going to be Ken Pinion, Roxanne Lewis, Sandra Moore, Will Hodges. I think Ken is the observer. I think you put in the chat.
I am, yeah. So, up there's my time. Okay. So in our room, I observed a patient meeting with a healthcare provider about persistent GERD symptoms. This patient had been to several providers before, about four doctors, and trips to the emergency room. And she shared ongoing symptoms and previous tests with the doctor. So the provider followed a pretty structured approach, asking about medical history, current medications, past diagnostic tests, and also whether an ROI had been completed to exchange information with the previous doctors. The diagnosis was pretty complex, so lots of questions by the doctor had to be asked in order to figure out what was going on and where the patient was in terms of their diagnosis. There wasn't a lot of opportunity for the patient to ask questions as a result. The doctor discussed lifestyle changes, treatment options, and also gave a timeline for improvement. There was also an advocate present, and her brother was present as well during the appointment. And I'd like to thank the Academy for this wonderful award. Sorry, I was my joke in the chat. It was like the Golden Globes when that music plays.
Thank you, Ken. And last group, we got Amber, Arnold, Don, Isaac, and Paul. Who was the observer for that group?
We actually had two observers. Could you hear me?
Yeah, Arnold, were you one of them?
Yes, me
Go
and Amber.
go ahead.
Um, okay, our patient was Isaac. He presented. Uh, he was going up and down the stairs in his apartment complex, and he was getting winded and needed some information about what was going on because he asked for a lower apartment and he couldn't get it. They said he would need a doctor's note, so he goes to the doctor, who was Dawn, very good doctor. She was observant, listening to his claim. She also diagnosed him with asthma, chronic asthma. She would like to have ran some more tests. She was asking him, can he come in, or how was his availability about it. Um, she also ordered a machine for him. The advocate, the advocate, Paul, amazing, like a lawyer. He did push for this letter. He recommended that he needed that letter in order for Isaac to get a lower apartment. So he wanted to know how soon can he get it. And it was CC to him. She said ASAP she would do it. Of course, Paul was very adamant about that. So everything pretty much was like an open and closed situation. Everybody was participant, was amazing. He did get to the first floor apartment.
Hey.
So it was a good day for us.
Nice. Thank you. Thank you all. Y'all did a great job.
Awesome.
That's all the groups.
That's amazing. Excellent. I'm just so thrilled with how this turned out. And, I'm just so excited that it's amazing when you put yourself in the situation and you have and it's not anything you don't know. It's not anything you don't know. Just putting it together in a different way and realizing that you are extremely important in this process, that things can be just small changes can make big differences and make you feel so empowered. And that's what this is about. That's what this is about. So let me go on to. So I was supposed to do this before, but I'm going to do this now. So when you have that appointment, and we just did it with our observers, you want to sit back when you get home and say, how did the visit go? Like, how was it? Were your questions answered? Did you understand the diagnosis and treatment? And this is an important question. What would you do differently? All right. If you know that if you are a person that when you get bad news or you get unexpected news, you might not be quite there thinking wise, you might consider bringing a trusted advocate with you. Did you get new medications? And then also, how did the doctor or the healthcare provider react to your advocacy? Did they react positively to it? Were they put off by? I doubt that they would ever be put off by your advocacy, as long as your attitude is checked. So that would be my evaluation: is to go back and think about what happened and think about what you would do differently and did it go well. A lot of times when we have some of the issues that you all brought up in your groups, like shoulder pain, asthma, GERD, I think those were a couple things that I heard. You may look things up on Google first. And I would say, no. Because you're going to find that either you need to get a vitamin or take ibuprofen online or call 911. It's going to be one or the other. So I say the best time for you to Google something is when you have a diagnosis, and use trusted websites when you get that diagnosis. And some of those may be the cdc.gov, I don't know, and then the nih.gov may be a good trusted website as well. So we'll skip that, and I'm going to go to my concluding thoughts. This webinar has made me the happiest. I'm so excited to see the learning, to see the engagement. It's wonderful. So thank you for having me. The concluding thoughts are please arrive prepared for your visit. Now you know how to do that with those 3 tools we talked about. Empower yourself during and after the visit. Pace yourself regarding implementing the recommendations. If the healthcare provider gives you 7 things to do, just take them one at a time. Just take them one at a time. And then you can check in. If you have a follow-up appointment and you've done 4 of them, do you still need to and your blood is looking good or your numbers are looking good? Do you need to do the other 3 or are you good? Submit follow-up questions through the portal if needed. If you think of something afterwards, like I have been as a patient, oh, I should have said this, or oh, what I meant to say this, submit them to the portal because they can get answered. I speak to my doctor all the time through the portal. If follow all of the same steps to advocate for others as long as there is trust. Remember that trust is extremely important. And lastly, you got this. So I want to end with this quote. Um, Change will not come if we wait for some other person or some other time. We are the ones we have been waiting for. We are the change that we seek. And this is Barack Obama who said this. And lastly, thank you for having me. Here's the QR code if you'd like to purchase the book. Here is my website. I have some clips of some interviews and podcasts that I've done on there. So feel free to go to my website. Feel free to email me if you have any questions. I am delighted to have spoken to the Georgia Council for Recovery. Thank you for having me.
And you all will get a copy of this slideshow. And I put her website in the chat, but it's going thank you right now. So I'll put it in there again. But I just want to say, at the heart of this conversation, there's something very simple and very powerful. The belief that every person deserves to be seen, heard, and respected in spaces that directly affect their life and well-being. For many people we serve, talking about in the peer workforce and even outside of that, the healthcare settings have not always felt safe, welcoming, or empowering. They can bring up fear, shame, past trauma, or experiences of not being listened to. As peers, we walk alongside people who are learning, sometimes for the first time, that their voice matters, not just in recovery spaces, but everywhere, including the doctor's office, which is what we talked about today. Um, this is why this topic matters so deeply to the peer workforce and even outside of it. We are not just supporting people through crisis. We are supporting them as they build whole, healthy, meaningful lives. As individuals heal in recovery, they begin to want more for themselves: better health, stability, longevity, and the ability to take care of their bodies as well as their minds and spirits. Going to medical appointments, asking questions, understanding their own health, and speaking up for themselves becomes natural. And it's a part of healing. And often they don't know how to even do that. They don't know how to ask the questions. This is a natural extension of healing again. This work is sacred. It is relational. It is grounded in compassion, respect, and hope. As peers, we are uniquely positioned to walk beside people in these moments, not above them, not in front of them, but with them. May this conversation remind us of the power we hold as advocates, and y'all did a great job, the responsibility we carry with care, and the deep privilege it is to support others as they learn to use their own voice. Thank you for the work you do, Henraya. So let's give her a round of applause. Thank you for showing up with empathy, courage, and heart. And thank you for continuing to believe that people can heal, grow, and create better futures for themselves and for those who come after them. Thank you, thank you, thank you, thank you. As far as your certificate, that'll be sent out next week. Don't blow me up about that certificate. It'll be sent out next week by Alvin. You'll get a copy of this presentation along with that certificate. Let's blow up the chat, show our gratitude to Henraya, and y'all are good to go. We're getting out about 7 minutes early. Y'all have a good night.
Thank
Thank
you
you,
so
Henraya.
much. Thank you. Thank you. Have a